I'm Helen Souris. I'm the CEO for Cardihab. We solve the problem of people getting access to rehab after they've had heart event or surgery. And at the moment, about 80 to 90% of people miss out. So we are a digital solution that helps people get access to rehab anywhere, anytime, supervised by a clinical person who's got the qualifications to care for them. And we're Australian only TGA-registered product. So we're pretty proud of being able to be evidence-led digital therapeutic.
Yes, and no strangers to talking health tech. It's been a while since we've spoken on the podcast, Helen. So tell us a bit about what you've been up to, because there's episodes in the feed that people can go back to and do a bit of a deeper dive. But it's been a busy couple of months for Cardihab.
Has been, yeah. We're super excited because now there's so many more private health insurers who are providing Cardihab to any of their eligible members, including Medibank, Bupa, NIB, Queensland Country Care. There's a whole raft of providers now supporting people after their cardiac events. And particularly exciting right now for us is we've just had a publication accepted in the Digital Health Journal for the European Cardiac Society of results from Medibank's pilot. About 4 years ago, they did a pilot with Cardihab. They looked at people going through the program and compared the results of the members from Medibank to usual care, which is nothing, and conventional cardiac rehab, which is that in-person program. And the results are out, hot off the press.
Like they're in your hand.
They're in my hands, in a paper. What it shows is there's a 71% reduction in hospital bed days for people who have had Cardihab versus usual care.
Yeah, right.
So the biggest problem at the moment is bed day clogging up the system, emergency department visits, and we've shown that we can actually have a significant difference on that measure. So that's pretty exciting for us to show that program is working so well.
That's huge, having, I guess, as one thing for us to intrinsically know that, these, and you would have known for years and years that this solution would be like, well, it's helping and it would help the system. But I guess we're in healthcare. We need evidence. We need
True.
things, and these things take time to pull together. So
Totally does. And I think the key thing for this paper was it looked at the results at 30 days and at 90 days, but then they wanted to look at what happens at 12 months later. And the results are persistent. So we're actually helping people reduce their risk of a cardiac admission. They're reducing their risk of any hospital admission. And most importantly, the results and quality of the program are equivalent to what we're seeing in face-to-face program, which is the current gold standard. So arguably we get to more people because of the flexibility of the model. They have fantastic completion rates, 91% completion rate, which is pretty amazing.
Yeah.
And we're actually getting to them in a way that fits in with their lifestyle. So the program's more accessible, it's reaching more people, it's getting equivalent results to face-to-face, and it's hospital bed day reductions. So we're super excited because this now is a more contemporary piece of evidence that adds to the building evidence behind Cardihab, that our program is working really effectively in the Australian healthcare system.
That 91% completion rate, that's kind of, as you say, quite rare. And I guess that would be a concern. What I think as well, it kind of might address some initial concerns that we often see in healthcare around implementation, like, oh, well, at least when they're in person, we know they do things, or like, with more traditional methods of rehabilitation than X, Y, Z. And we're not sure if people will use something that's remote. But I guess that provides some confidence and some data to be able to...
I think as well, conventional rehab, people have access to those programs if they get access to them. There's massive wait lists, but there's also a lot of dropout because someone has to go to a hospital or to a clinic 2 to 3 times a week. And they have to be there for hours on end.
Yes.
And so people just get fatigued with that, or it just gets in the way of life and they don't attend. So there's between, I think it's 40 to 60% of people drop out of face-to-face rehab programs. They don't complete them because of the factors that get in the way of life.
Yeah.
So when we're talking about a 91% completion rate, and we know that completing cardiac rehab actually has a mortality benefit.
Yes.
It saves lives when people complete their rehab.
Yeah.
That's a really important difference that we're making there. So all up, we want to get everyone into the best model of care for them, whatever works for them. If they want face-to-face, that's great. If they can't get into face-to-face and the alternative is nothing, or if they want to do a virtual program because that's their preferred way of getting healthcare, give them the option. So our ultimate call to action for everyone is become a Cardihab provider or get access to the program, refer people through to our already growing list of private health insurers or public health services that are providing it, and really make this choice accessible to people because the results will be transformational to the service, but also transformational to people who save lives.